first question is, any numbers of suicide related to packs or daters, or is that old news?
So in my experience, I don't really hear a lot of that with the kids I work with. I do hear a lot of distress and conversation around like kids sending messages to one another about suicidal ideation or intent, and like being in like perhaps like a group text or like a conversation that's occurring and it's late at night and there's no adults around, and it can be really distressing for kids. And so I definitely see quite a bit of that, but I don't hear anything about packs or dares or anything like that.
So I also don't have the data on that, though one of the things that became sort of political was when, and I can't remember how recent this was, there was, I think, 5 suicides within one general region among youth, and so this became more of a topic that our senators were looking at and trying to address. I unfortunately just don't know what the outcomes of that were.
And then I will add one piece of information. There's been some really interesting research being done on, Dr. Albert alluded to the 13 Reasons Why show, and there's actually been some fascinating research out there by a few different groups throughout the country looking at spikes in suicide attempts following like airings of those shows. And so I mean, it's pretty compelling stuff, honestly. I mean, that definitely there's limitations with that research, but it's been pretty interesting to look at that as well.
Let's see, this is a great question. Suggestions for working with parents who are, quote, in denial about their child's emotional state.
I like to think that most parents, when being confronted with a professional who is telling them that I'm really concerned and I think this is a problem, I feel like in my experience, most parents respond to that. But when I feel like there is not a level of buy-in or engagement, I think as much as possible, thinking through how you might set up your time and your visit to include not only the child who you're working with directly around like identification of coping skills, working with them on their youth, but also creating space for the parents and to be able to talk with them about their role has been really helpful just to get that level of buy-in and kind of creating this collaborative effort, because I think on one hand you want to create a space where a child can come and have that autonomy to talk with you, but if it's happening in isolation and the parent isn't really doing anything or following up, then the ability for the child to get the help that they need or to like engage in the community resources that might be available is quite low. So I find that by creating a space to have conversations with the parent, that can be really helpful. And as you bring the child back for follow-up, that you're continuing that discussion. So it might not necessarily happen in the first visit, but over time, I think some of that can be helped, and a lot of that can just be that it's a little bit of like a defense, and they're feeling overwhelmed or stressed out, and they just maybe feel helpless or they don't know what to do. So that's the response you're getting. When really, if you can coach them and give them resources, it might help like bring down those barriers.
Yeah, that was what I was going to contribute was as much as you can trying to identify with that parent or caregiver, what is salient to them and what they're doing well, to help use those strengths to then be a support for that child, making sure that what the child is going through is normalized, that this is something that affects a lot of our youth. Likely over 1 in 5 of our youth struggle currently with a mental health and substance use condition.
making sure that we're doing what we can to pull out those strengths and using them to enlist support for the patient.
Great. So this is more of a question of what you would do. Do you ever reach out to the school of a bullied or depressed or suicidal patient and work directly with the school counselors or nurses?
I have done that before in certain circumstances. I try to definitely empower families to do this on their own, because obviously we don't have the bandwidth to be calling a school every time this comes up, nor it probably isn't appropriate in a lot of situations. But for example, if there has been some kind of a response and the problem is continuing and the parent is really at a loss and doesn't really know what to do next, sometimes just a conversation to help me understand from their perspective what the barriers are or the issues to getting that child help can be really enlightening in a lot of ways. And I find that the school often really wants to hear from us and appreciates the feedback. So I have done that in certain circumstances. As far as like bullying is concerned, less so I think with just other mental health conditions. But I think like advocacy can look like a lot of different things. So I think just even if they're asking for documentation of their diagnosis so they can share that with the school to get some additional support, like that's definitely something that we can do very easily.
And I've communicated with schools around just being on the same page with regards to a crisis response plan. And similar to Dr. Quinn, do this on a case-by-case basis related to the bandwidth that exists in primary care. And I love helping to give families the tools to be able to do this advocacy themselves, because this goes a lot further.
So what have your experiences with the National Suicide Prevention Line versus the text line? Have you ever had feedback from a patient, and are there differences in those two and how they respond?
I just find that a lot of youth will say, I will not call somebody that I don't know, or I'm not going to call an adult phone line. And so having a text line, there's also an online chat. These aren't actually offered 24/7 the way the crisis numbers are. But in terms of thinking about kind of assessing confidence of what is a child or adolescent most likely going to use, I want to give them the tools that are most likely for them to use.
Yeah, I kind of piggybacking off of that, I think a lot of you are aware of Teen Link. Have you guys heard of that? So it's www.teenlink.org. And so that is a website that is connected to the crisis line, but it's specific to youth. And so on that website, youth are going to encounter a number of different resources, different kind of supportive, things that they can look at. And then nightly from 6 to 10 p.m., there is a confidential chat. And I believe the folks who are running that are trained through the crisis center, but they are youth. So instead of it being an adult that they're talking with, it's actually a trained youth who they can chat with and get that support. And they also have the option to call in as well. So just, again, kind of giving that menu of options and letting them decide what's most comfortable for them.
Great. Dr. Albert, there's just a clarification question regarding the 17% statistic acknowledgement of suicidal ideation. 17% of patients who admit to suicide verbally will check yes on the PHQA.
So, great clarification question. It's that only 17% of those who have endorsed some level of risk on question 9 of the PHQ, so the one that assesses suicidality, only 17% of those who've endorsed will verbally share with their provider that they are dealing with that.
think your point of that was to make sure that we as providers look at the form if it's been completed.
Yeah.
And review
Yep.
it. This is a question regarding bullying. There seems to be an issue of parents and kids throwing around bullying accusations loosely. How do you recommend helping kids and families discern the difference between bullying and the common social conflict of that age?
Yeah, I think just knowing the definition of what bullying is and being able to assess it and then talk through what you're hearing can be helpful. So if to you it sounds like maybe they're going through some really tough stuff, but it's not exactly bullying, then you might somewhat change your approach there, which I think the main key piece would be trying to problem solve and help them work on their relationships and communication versus like actually getting the school involved and like going through the steps. So that would be a little bit of a different approach there if you think it's like really bullying or not. And I think providing some of that feedback, if they're saying, if the parent says, my kid's getting bullied all the time, like it's happening at school and all these kids are bullying them, and then you ask more questions and you don't think it's bullying, then I think trying to share, it sounds like this is a really difficult situation and it's causing a lot of harm. And it doesn't quite sound like bullying to me, but because of what I'm hearing, this is the approach I would recommend, can really help make sure that they're kind of focusing their efforts in the right area and not going down like a rabbit hole that might just make the scenario worse.
And back still with bullying, what you went over some questions that you use for the person who's being bullied. Do you have some screening questions where you might use to identify the person who is a bullier?
Great question. I did not include those. And I think it's a little bit tricky because it's a little bit more, there's like more face validity by like asking, are you being mean to other kids? Are you picking on other kids? I think it's kind of obvious what you're getting at there. But, I think by just having a conversation around, like starting it off by saying, what do you think about school? What is your school like? What are the kids at your school like? What are, do you have friends? I try to say, do you have friends versus like, what are your friends like? Because that's an assumption that they have friends. So I try to avoid that. So like as you're having, oftentimes I think what'll become clear initially is that they're having peer conflict. They might not be admitting that they have a role in that conflict or like what their role is, but like it might become clear through the questioning that there's some level of conflict, and then maybe asking more specifically, well, can you give me some examples of what's going on? Or can you tell me a little bit about the problems you're having with other kids? They might be able to share it with you a little bit more, and then you can kind of see what side of it they're on versus the other.
And this is for both of you. Do you take into consideration the cultural, family relationships, and religious beliefs that affect incidents and/or interventions?
Yes, and with regards to suicidality, exploring beliefs around death or suicide can give you really useful information about potentially protective factors, and understanding those beliefs really helps with informing what interventions you may select for that individual and that family member.
Yeah, I think the place my mind goes to is protective factors, because I think for a lot of folks, if they are engaged in a religious community, oftentimes that serves as either some kind of social support, or because of the beliefs within their religion, it might be that, that's not something that, their religion agrees with. So some of those kinds of factors might actually serve as like a protection against actually falling through on suicidal ideation. So I think in a lot of ways it can serve as a protective factor.
Couple more quick questions. Just sort of for our own information, when we're counseling schools, are you aware of any technological tools, tech tools that the schools can use to monitor bullying on the social platforms?
I'm not aware. I know in Washington State, the way the laws are set up are that if the act is not occurring on campus, so if it's cyberbullying and there's no evidence that the bullying is occurring on campus, then their standard is if it has the potential to affect the child at school. And I would argue that like in pretty much I'd like you to show me a case where like it doesn't affect them at school, but that's what they're saying, is that like if you can show evidence that this has some impact on their learning environment, then they can act upon it. But if it's really this standalone thing that's occurring off campus that isn't having any kind of impact on the child while they're at school, then it's not really something that they can intervene with. So that's kind of specifically with cyberbullying and like that world. The school is a little bit, I guess, limited in some degree about how they can respond.
That's great. And then finally, are either of you aware of programs to coach the layperson or parents of students and how to do a crisis response plan or a brief intervention?
So one of those is mental health first aid. There are trainings that are available to Swedish caregivers to do this. Then additionally, you can actually do a very quick Google search, and there are going to be a number of really good toolkits that you can access online for schools, for parents to walk them through how to do these and how to do them well.
Great. Thank you both so much. Sorry if I didn't get to everyone's questions, but we're going to take a break for 15 minutes. Let's give Dr. Quinn and Dr. Albert